Confidence is very important when you're doing a procedure. If you're not confident, you're worried, you don't feel like you know quite what you're doing, patients are going to pick up on that and be uncomfortable. Having the skills lab allows you to obtain that confidence, and you will therefore project that to the patients.
The skills lab is great. The setup that we have here is really something special. I think is one of the great things about the hospital, and for us as OBGYN residents, when it comes to doing surgery and being in an operating room, a lot of what we do is from a laparoscopic standpoint.
A lot of times when I'm doing these procedures, my patients are awake. So you need to know exactly what you're doing. You need to portray that you have confidence and that you are very confident in doing this procedure. So in the skills lab, it allows you to practice and have that rhythm down of doing the procedure, so that when it comes down to actually doing it and you're in front of a patient, there's no question.
The most beautiful thing about the skills lab is you can make a mistake. You're not going to change or alter someone's life because of the mistake you make in the skills lab. We want you to make the mistake in the skills lab. We want you down here enough where you correct all those mistakes so that when you go out on the floor or in the emergency room or in your office, that you're performing a skill that you're completely confident in.
As a resident surgeon coming to the skills lab, we're able to use some of the equipment here that helps us to prepare for actually doing procedures in the operating room. Some of the things like staplers that we use during laparoscopic procedures, we can actually practice with those before we go into the operating room.
Coming to the skills lab has made me a better resident and a better physician because, again, it's given me the opportunity to practice. It's given me the opportunity to go through those case scenarios in a non-stressful setting. I can kind of walk through things. Well, how are you going to tie this knot? How are you going to grab here? How are you going to clamp here? As opposed to being in a high-stress situation like in the operating room when something's potentially going wrong and you need to be able to rely on those skills immediately.